it's Jennifer Sherman. I'm back on video. It's been a while. I wanted to post a bunch of pregnancy stuff. I'm pregnant with my second right now, just 4 months in and already feeling big, but those of you who've had multiple kids probably have that same exact feeling. Anyway, I thought I would do some yoga techniques to help with anybody who's pregnant or just stretching in general. So we'll start out in an easy cross-legged position. You don't have to put one leg on top of the other. That's just if you're comfortable or not. You could sit cross-legged like this, or you could sit with your legs apart so that you have room for your belly and knees back, whatever's comfortable. So right here, just relax your hands down on your knees, close your eyes. Take some deep breaths. Inhale through your nose. Exhale through your mouth. During labor, this is the type of breathing that will help control your body. Inhale through your nose. Exhale through your mouth. What I want you to concentrate on, when you inhale, expand your belly. As you exhale, pull the belly button in, so like you're sucking in. Inhale, expand, exhale, pull everything in. When I gave birth to my son, this is how it was easiest for me. I had the epidural after several hours, and when it came time to push, I couldn't feel much. So I would look at my stomach, I'd inhale, expand my stomach, and as I exhaled, I just visualized my stomach pushing in, and I would push my belly button toward my spine, and it helped me push my son out rather quickly, especially for the first delivery I've ever had. So hopefully this will help you if you've had problems in the past or if you're new to this. So keep inhaling and exhale. Good. One more. Pull that belly button in, and I want you to come to all fours on your hands and knees. We're going to do a pelvic rock. So just concentrate on moving your pelvis. It's like cat and cow, except smaller movements. We're only focusing on the lower part of our back and our body. This right here actually helps position your baby head first, and as you get further along in your pregnancy, or if you're toward the end and in your third trimester, the head will start coming down toward the cervix. This helps relieve sciatica and different pressures that you might have in your back. Actually, when I get nauseous, I do this and I feel a bit better. Couple more. Pull that belly button in as you round your back. Last one, and now we'll come into downward dog. So hands in front of your shoulders a bit, flex your feet, straighten your legs. Walk this way so you can see me. Try and push your heels to the ground. Of course, the further along you are in your pregnancy, the wider your feet are going to need to become. So if you're just became pregnant or you have a smaller tummy, you can always step your feet in closer. If you're in your third trimester, you probably will be more comfortable with your legs wider than hip distance. Good. And now what I want you to do, take your right leg, lift it up in the air, stretching nicely, bring it down to your hands on the outside of your feet. Straighten that back leg, drop the knee down, open up your right knee. Good, and just hold it here a little bit. This helps open up your hip bones, allowing more room for the baby. As we get pregnant, our joints tend to loosen up, and the further along I got in my last pregnancy, the more pain I was in, and I found if I didn't stretch, I could hardly move. So this really helps. Straighten that foot, bring the knee back into the arm, straighten the back leg, walk heel toe your foot in to your hands so that you're in half pigeon. So your right knee is in front of your right wrist, right foot in front of your left wrist. And just hold it here. Nice. We hold our tension in our hips. The more flexible you get, the more parallel you can bring your foot to your hands by sliding your foot in front. If you need to, you can keep your foot under your leg and your hips. One more deep breath. As you exhale, flex the back foot, straighten the leg, and come back to downward dog. You can go ahead and walk the dog, bend your one knee and then the other. Lift that left leg up and step it to the outside of your feet. A nice deep lunge here. Drop the back knee, relax the top of the foot, and open up that left knee again so that the arches of your foot, the soles of your foot, is up off the ground. Hold it here. Nice deep stretch. One more deep breath. Straighten that front knee so that the knee is now touching your arm. Go ahead and lift the back leg, walk that left foot so that the foot is in front of your right wrist and the knee is in front of your left wrist. Straighten up nice and tall. You want to breathe through any tension. This will help clear your mind, help you feel strong and good. Deep breath. Good. Now I want you to put all your weight onto your left hip. Swing that right foot forward so that you are in butterfly position, what I call it from dance. Soles of the feet together, knees apart. Push them down, sit up nice and tall. Take a deep breath. And as you exhale, I want your back straight and I want you to lean forward. Feeling the tension in your hips. Breathing into that tension and letting all the tension out. Good. 2 more deep breaths. And again, when you inhale, expand your belly. And as you exhale, pull that belly button into your spine. And as you're in labor, if you're having a vaginal delivery, I want you to concentrate on that. Focus on your breathing. That's what you can control. I understand it's painful and pushing is probably the hardest part. It's exhausting, but concentrate on the breathing. Now I want you to inhale and bring your legs out in front of you. Again, the further along you are, you probably need to widen your legs. Whatever is comfortable for you, you can always keep your knees slightly bent depending on how tight your hamstrings are. We're going to do a nice spinal twist. So I want you to take that right foot, bend it. Again, if you're further along in your pregnancy, you're going to need to make room for your belly. If you're in your second trimester or your first trimester, you can bring your knee in closer. That's up to you, whatever's comfortable. Take that right hand, put it behind your back, helping you stabilize and really stretching up through the spine. Left arm up, and I want you to twist around your leg. Now, if you're further along or you're uncomfortable, take your hand and use your hand to twist so that there's more room in your belly, okay? Everything can be modified. Do what feels good for you. And if something doesn't feel well, then you need to stop or back off a little bit. Now's not the time to push your body. It's time to listen to your body. And always ask your doctor if something seems to be wrong. All right, let's switch your legs. Take that left hand, prop it behind your back, right arm up, and twist. Elbow to knee, or hand to knee, depending on what's comfortable for you. Keep breathing. Reach up through the spine nice and tall. Good. One more. And as you exhale, release. Come back onto all fours. A few more pelvic tilts. Should feel good. Releasing tension in your spine. Put your feet together, knees apart, and I want you to come down into child's pose, however far you can get, and just hold it here. These are simple stretches that I find important for pregnancy especially. These are stretches I like to do when I'm pregnant or not. But as I'm pregnant, I feel a bit tight and a bit tense, so I find that these stretches calm me down, especially after I've been running around with my son, and they just relieve tension, they make me feel better, and they help me concentrate on the baby growing inside me and my pregnancy, because, well, when you're a mother of more kids, you tend to forget what's going on with your own body, so it helps bring you back to reality. I hope everyone has a good day. If you need me, you can find me on Facebook at Sherman Health and Fitness. And have a wonderful day. Stay healthy. Eat well. Your baby depends on your nutrition. Have a good day.